نحمده ونصلي على رسوله الكريم أما بعد فأعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم ولنبلونكم بشيء من الخوف والجوع ونقص من الأموال والأنفس والثمرات وبشر الصابرين. Dear respected ulama, it's a great honor for us to come to this majlis today and to talk about this important topic about mental health and the role of the ulama. So inshallah, I'm just going to go through the aims, then I'm going to pass over to my colleague Dr. Majid Saleem to go through the first part of this presentation, and then I will go through the second part, and inshallah after that we will have a quite a lengthy questions and discussion session which Mufti Abdul Wahid will be facilitating. And then we've got the Slido. I'm sure you guys are more into the tech for you to send your questions and discussions through, inshallah. So the first thing we will talk about is a bit about the mental health, some facts and figures, some of which you will be quite well aware of. And then we'll have a bit of a discussion about, are we seeing more mental health problems in society today? So some personal reflections as well as some discussions about certain difficulties that might be more prominent now compared to before. And then we will try to just give you a discussion about some of the debates within psychology and psychiatry and to think about where we fit in within this debate. And one of the things is to think about how as alims, where we sit within understanding mental health and what part we may play in terms of supporting people with mental health difficulties. So we'll talk a bit about advantages and disadvantages of diagnoses, and then we'll talk about the importance of having a holistic model in terms of understanding our mental health, which takes into consideration the importance of our spiritual well-being, because in essence, from an Islamic perspective, there's no difference between mental health and spiritual health, whereas in Western secular society, we may differentiate this. Or if I was to query myself or somebody about it, what is different, I don't think it's that easy to tease apart. Then I'll go on to then talk about some case examples, and then we'll talk a bit about what can we do as ulama to upskill ourselves and to support people both individually and as a community to support the improvement of our mental and spiritual well-being. And then on the last part, I will talk a bit about I think sometimes it's very important that we start from a position of understanding our positives and strengths. Sometimes when you look at some of the groups and people saying, well, we're not doing this, we're not doing this, we're not doing this. But in psychology, it's important that we start from a position when we talk about like a solution-focused approach of more from a positive perspective, to think about what are we actually doing and to what extent do we need to reinvent the wheel, or to what extent we need to just work on things that we are doing more better to prevent mental health problems from occurring. So we'll talk a bit more about prevention is better than cure. So.
He always gets me to do the boring bits, but I love them anyway. So let's get going. So just looking at some kind of basic statistics within the UK, we've got 1 in 4 people who will experience a mental health problem each year. I mean, that's very, very significant. It's more common than probably lots of other physical healthcare conditions that we are kind of aware of. Just within our communities alone, if we look at the rates of diabetes, it seems like in my family, everybody has diabetes. But if you look at the stats, mental health problems are actually more common than things like diabetes. So that's quite a profound statistic, I think. And in England, 1 in 6 people report experiencing a common mental health problem, such as anxiety or depression in any given week. So, I mean, if you just kind of look around the room and see how many people we have here today, mashallah, just think 25% of the people at any given time may be experiencing some kind of common mental health problem. We also have the kind of more complex mental health problems, which the statistics are slightly different for. So, for example, I think at any given time, 1% of the world's population might be experiencing some kind of psychosis or schizophrenia. I mean, if you think about the size of the world's population, is it 6 billion at the moment, I think? And if 1% of those people are experiencing a psychosis or some kind of schizophrenia, again, that's lots of people around the world. 1 in 8 adults with mental health problems are currently receiving treatment. Most commonly, this treatment will be in the forms of medication, which I don't think we really talk much about within this presentation, but there's obviously kind of pros and cons to taking medication. In my experience, as something within the short term when people are acutely unwell, medication is usually a good course of action, but then kind of long-term use of medication can also be very detrimental to you physically and cause lots of side effects which are very undesirable. And there are some statistics out there to suggest that they can actually take off between 5 to 10 years of your life if you are kind of heavily medicated over a prolonged period of time. So all of this data has been taken from a website called mind.org.uk, which is an organisation which is funded by a charity here in the UK. On a more serious note, suicide amongst men, it's now kind of considered the leading cause of death for men under the age of 50 years of age. Those statistics come from the Office of National Statistics in 2015. This is something I think which is becoming more and more prevalent as time goes on, and kind of we'll discuss that in the next slide as to why this may be. But if you look at kind of suicide rates across the country, I think it's predominantly within kind of Caucasian communities where you see quite high rates of suicide, and especially amongst kind of farming communities, because they have access to firearms legally, so that they have the means to kind of participate in those kind of behaviours, I guess. It's kind of a nice way of putting it. And then if we kind of look at self-harm in women between the ages of 16 and 24, 1 in 4, which is roughly 25%, compared to 9.7% of men in this age group. And again, that's quite a large disparity between the kind of genders. But again, there's a kind of multitude of reasons and complexities behind why women will often engage in self-harm, particularly kind of within those formative years of their lives compared to men. But the men are more likely to take their own lives as opposed to kind of self-harm, which can often be seen as a kind of cry for help and kind of people looking for more support externally, not just within the family, but also from kind of the wider community as well. So why do we have an increase in mental health problems? I mean, we've got a list of things here. I'll just run through them really quickly. So we have the pressures of modern society. I think the internet has a large role to play within that. What kind of pressures do we actually have? There's this kind of, I think even within our communities, and probably if you broaden that out to other communities as well, there's a pressure for people to be successful at a very young age, get a good education, have a good job and good money, have a nice house, have a nice car, wear nice clothes, go on holiday twice a year, and these are all the kind of pressures which either society kind of forces onto us, or stuff that is more internalized sometimes, and we kind of force onto ourselves and have quite, I think, sometimes unrealistic expectations of ourselves, and kind of put ourselves under added pressure. The kind of COVID-19 pandemic, which we've all been through over the last few years, has definitely highlighted lots of disparity within kind of mental health within various different communities. I think amongst the kind of Asian and Black community, the statistics were quite astounding, actually. But again, the pandemic kind of changed the way we were all living our lives. You were no longer allowed to leave your house. You weren't allowed to kind of socialize with friends and family. You weren't allowed to attend funerals. You weren't allowed to attend weddings. And the kind of whole structure of the way we live our day-to-day life, even praying Salah in the Masjid, that was stopped for a long time. And when we did come back to the Masjid, we all had to be kind of 2 meters or 2 feet away from each other. So it kind of just changed the entire dynamic of our lives. And that really did have a knock-on effect for lots of people who really kind of, their whole identity was rooted within our communities. And when that was taken away from them, it became very difficult for those people to kind of readjust. And also, interestingly, kind of anecdotally speaking, through my own kind of clinical practice, I saw lots of kind of marital problems because people were actually spending lots of time with their husbands and wives, which previously they hadn't done because they were either at work or they were out doing other things. And when people are forced together in a situation where you can't get away from each other, lots of cracks and fractures started appearing within kind of relationships as well, which I thought was very, very interesting. In terms of religion and kind of spirituality, there has become a real void, especially in this country and within the Western world, because society has become kind of more and more secular as time has gone along. And again, when you have nothing really to fall back onto, and everything that you have, you kind of look at it through the lens of science and secularism, that can cause lots and lots of problems for people, because then there is no kind of greater, deeper meaning or understanding of the experiences that you might be having outside of what science can prove. And a lot of the times science can't prove anything. And as psychologists who have been working, both myself and Dr. Khan, over the last 20 years, we can kind of quite confidently tell you that we still have a very limited understanding of how the human brain works, and what kind of issues are causing certain problems in certain people. On the flip side, there's kind of more recognition and help available. So kind of when we were coming through the ranks back in the late 90s, it was very rare that you would see people from the kind of Muslim community accessing mental health services. They were kind of, the running joke was mental health services were exclusively for white middle class people. Things have slightly changed over time, but again, I would say the vast majority of people that do access services probably still are kind of white and middle class. But now that we have more kind of outreach work, and there's a lot of kind of brilliant work being done by various different organizations within the communities, there is more help available for people, and people are slowly but surely kind of willing to access that help. But there still is a huge stigma attached to kind of mental health problems as well, which is kind of a barrier that we really do need to work on to help overcome. And then we have this issue around kind of collectivism and individualism. So what we found within the kind of Western concepts and the Western ways of living, they've kind of moved away from that collective way of living, and everything has become very much their kind of nuclear family. And outside of that, they don't really give much kind of time or consideration to anybody else. Something that comes to mind is a doctor psychiatrist from Sudan once told me that they have villages in Sudan where when somebody is experiencing mental health issues, what they do is they gather all the elders of the village together, and then they have a discussion about what it is or what ills there are with the way they are living their lives that is manifesting itself in this person in this way. So as opposed to kind of putting all the kind of emphasis on the one individual who's experiencing the problems, they say, okay, collectively as a society, what are we doing wrong? What are we doing wrong that is causing this person to behave in this way? So it's a kind of collective responsibility and ownership that people take, as opposed to just pointing a finger at people and saying, well, actually, it's your problem, you need to deal with it. So that's something which I think we in this country are probably struggling with quite a lot as well. We have lots of people kind of living alone and in isolation. We know that's kind of, from a mental health perspective, that can be very, very kind of dangerous. People don't have anyone to speak to. We know there's a huge problem amongst the kind of indigenous population of this country, let's say, where their elderly people are kind of being left alone, and they have no one to talk to, no one to speak to, no one to help with their kind of daily chores, no one to communicate with. And what you'll find is with that kind of way of living and that kind of lifestyle, it becomes very difficult for people to reach out and actually ask for help when they need that help. We have a huge rise of Islamophobia, going back post kind of 9/11. I think pre 9/11, although Islamophobia was a thing, it had never actually been coined. There was no kind of language to describe what was going on in terms of kind of what's a phobia? Phobia is an irrational fear of something, and now we have this kind of irrational fear of Islam from lots of different quarters. I think that, again, there's a lot of good work being done. If you look at the kind of people, the amount of people in this country who are reverting to Islam, it is quite eye-opening. But again, the kind of people feeling uncomfortable within their own skin and not knowing their identity, which is a huge issue as well. A lot of our youth are going through an identity crisis. They don't know who to turn to. They're being influenced by so many different people at the same time. You've got school telling them one thing, you've got the masjid and madrasa telling them something else, you've got their parents telling them something else, you've got their peers telling them something else. And, how do you kind of navigate that, and how do you develop your personality when you have so many external influences telling you what you should and shouldn't be doing and what's right and what's wrong? So I think that's, and then when you kind of throw in the Islamophobia into that context, it kind of does cause lots of problems. There's also been a kind of link to that, a recent rise within kind of racism and the rise of the far right. If you look at the kind of information that's coming out from the Home Office at the moment, the biggest threat to this country is kind of extreme far right ideology. The kind of people like the EDL. They've even made it into mainstream politics with kind of UKIP, who are kind of extreme right wing, just in disguise. So there's kind of lots of issues kind of on a societal level and at a more structural level as well. And there's kind of lots of structural racism kind of embedded within that. And that's even across all the organizations that we work in, whether it's the police, whether it's the NHS, whether it's the kind of education system, they do definitely have this kind of post-colonial mindset where they want to kind of enforce their ways of living and beliefs over ours, saying, ours kind of should take a higher credence than what yours do because we see ourselves as kind of intellectually superior to you. It's a huge problem. And I can't see how, that's going to get any better. It's going to get worse before it gets better, in my opinion. There's a huge societal change as well. So kind of if you just think about the kind of communities that we live in, the kind of overcrowding, the pollution that we have, the kind of work-life balance that people have got. And a really poor kind of education system in terms of what the state are providing us, kind of disgraceful criminal justice systems, which are kind of passing out kind of arbitrary criminal kind of sentences on people for offences that, people from other communities wouldn't get the same kind of sentence. And all of these things are risk factors. They're all risk factors. If you look at, I've spent a lot of time doing research in kind of schizophrenia and psychosis, both in this country and in Canada. And, these are all kind of risk factors for people kind of developing a first episode of psychosis and then kind of going on to kind of developing more longer term schizophrenia as well. And then also, like I mentioned before, we've got the internet. There's positive and negative aspects of a digitally connected world. I myself am not that savvy when it comes to the internet. I think that ship has already sailed. But, with kids kind of accessing forums like TikTok and Instagram and, you have all these filters where you take your pictures. There's huge issues now around body image and body dysmorphia. People not liking the way they look, people refusing to kind of go outside without putting copious amounts of makeup on. Because their self-esteem and self-worth and self-confidence has been beaten down by society saying, you have to look a particular way. You have to look a particular way. There's kind of places in the world. I think I heard this, an Iranian doctor was telling me the other day that the highest number of plastic surgery and cosmetic surgery operations in the world actually happen in Iran, which was a shock to me because I didn't think that, the society was like that. But that's what's going on kind of within the Muslim world as well. And a lot of this can be attributed to this kind of perception of what people should look like, whether it's male or female. So mental health diagnosis, the importance of diagnosis. So the diagnoses are usually kind of given using two different types of criteria. We have the kind of DSM, which is the Diagnostic Statistic Manual, version 5, which is an American tool. And then we have the ICD-10, which is used more widely in kind of UK and Europe. And this is where we get our kind of diagnostic classifications from. There are advantages and disadvantages of being diagnosed. The advantages are that you will have access to services that are available, but the disadvantages obviously are the kind of stigma that comes attached to people being diagnosed with various different mental health problems. And this can lead to over-medicalization and kind of a pathologizing of everything that happens in our lives. So kind of 20 years ago, there would have probably been hundreds of thousands, if not millions of people out there who were depressed but didn't ever receive a diagnosis of depression. But now things have kind of changed massively. And we're kind of on the other end of the spectrum now, where if you have a couple of bad days, I wouldn't be surprised if your GP prescribed you an antidepressant and said, here you go, you're now depressed, So there's a real balance that needs to be found, and I don't think we are kind of anywhere near finding that at the moment. And then also there's an importance of looking at problems holistically. So we need to look at things from lots of different kind of angles, through lots of different lenses. So whether it's a biological aspect, whether it's a social aspect, whether it's a psychological aspect, and obviously whether it's a spiritual aspect. And I think that's where, as a Muslim community, we're very fortunate that we do have spirituality on our side, whereas kind of amongst the kind of more secular people that we live amongst, they don't have that element. But then on the flip side of that, there is a problem with an over-focus on spiritual aspects. So maybe about 5-6 years ago, I used to work in Bradford, and I spent a few years working here, and I'd say 95% of the Muslims that walked into my clinic would always come with the view that somebody had either done black magic on them, or that they were possessed by a jinn, or that they had the evil eye on them. And when people have that kind of mindset, and you have to work within that kind of framework, lots of times kind of through having kind of discussions with various different people, consulting the ulama, sending people off to kind of see various ulama to kind of ascertain what is actually going on for them on a spiritual level. I'd say 95% of the people or if not more, would come back, and the opinion will also always be that no, there isn't anything to do with jinn, there's nothing to do with black magic. This is purely a psychological issue. But sometimes people convince themselves, or family members will convince you that no, you're possessed by a jinn, and that explains kind of all these bizarre behaviours that we might be seeing, but not always necessarily the case. And sometimes it can be a little bit unhelpful because people kind of lose the flexibility to be able to look at things from a different perspective. So this is kind of the last slide for me. So if you just look at this model, so this is kind of what I was talking about looking at things through various different lenses. So we have the biological element, which can be kind of a genetic vulnerability or a predisposition because of a family history to people developing mental health problems. Other things like people having neurodiversity, which is autism and ADHD, and also a learning disability can make you more susceptible to developing things like depression and anxiety. And then the social kind of areas are things like what is going on within the society that we live. So you're looking at things like schooling, education, healthcare, criminal justice systems, welfare systems, the kind of financial situations of people, and kind of living situations and things like that. And then the psychological side is obviously the kind of things that myself and Dr. Khan deal with. And that's looking at kind of the way people think about things, the way people behave, and how that has a knock-on effect on the way they kind of think about things. And then there's also the kind of other kind of interventions that are available to help people kind of deal with things on a kind of higher order psychological processing side. And then the spiritual side. This is kind of where it's very, very important. I think like people like yourselves need to get involved and kind of have a larger and better understanding of mental health issues and how and what kind of role you can play, what role the ulama can play in helping people kind of deal with mental health crisis. And as you can see from the diagram, there's a huge overlap between all of these areas. And I think it's very important that we look at everything from a kind of holistic perspective as opposed to just focusing in on one thing.